If you're struggling with a stiff and painful shoulder that seems to have come out of nowhere, or if you know someone who is, this video is for you. Today we're diving into a condition that can dramatically affect day-to-day life but is often misunderstood: frozen shoulder, also known as adhesive capsulitis. We'll walk you through what frozen shoulder is, how it develops, what symptoms to look out for, how it's diagnosed, and most importantly, how it can be treated and managed. Whether you're experiencing early symptoms or you're deep in the recovery phase, this video will give you the information you need to understand your condition and feel more in control of your journey to recovery. Frozen shoulder is a condition that affects the capsule of the shoulder joint. Your shoulder joint is a ball and socket joint surrounded by a strong connective tissue called the joint capsule. In frozen shoulder, this capsule becomes thickened, inflamed, and tight. Over time, bands of scar tissue form and there's less synovial fluid to lubricate the joint. The result is restricted movement, significant stiffness, and often chronic pain. The condition is called frozen shoulder because quite literally the joint becomes stiff or frozen in place. Movements that were once easy, like reaching overhead or behind your back, become difficult or impossible. Frozen shoulder most commonly affects people between the ages of 40 and 60, and it occurs more frequently in women than in men. It can affect one or both shoulders, though usually not at the same time. There are some key risk factors including diabetes, thyroid disorders, Parkinson's disease, and previous shoulder injuries or surgeries. In some cases, it appears without any obvious cause. There are two main types of frozen shoulder: primary and secondary. Primary frozen shoulder has no known cause, while secondary frozen shoulder results from another condition such as an injury, surgery, or prolonged immobilization. Frozen shoulder typically progresses through three distinct stages, each with its own characteristics and time course. The first stage is the freezing stage. This is when the pain begins, often gradually. It may be more noticeable at night or when you move your shoulder in certain ways. Over time, the pain worsens and the shoulder becomes increasingly stiff. This stage can last anywhere from 6 weeks to 9 months. The second stage is the frozen stage. Pain may actually improve somewhat during this phase, but stiffness remains, and in some cases worsens. You may have great difficulty moving your shoulder, and everyday tasks like dressing or reaching for items can become frustrating. This stage typically lasts for 4 to 6 months. The final stage is the thawing stage. During this phase, mobility gradually improves and the shoulder slowly returns to normal or near normal function. This phase can last from 6 months to 2 years. In total, frozen shoulder can last anywhere from 1 to 3 years, depending on the severity and the treatment approach. The main symptoms of frozen shoulder are pain and stiffness, but how these symptoms show up can change depending on the stage of the condition. In the early or freezing stage, pain is the dominant symptom. It can start suddenly or gradually and often worsens over time. You might find it difficult to sleep on the affected side, and reaching overhead or behind your back may become increasingly difficult. As the condition progresses into the frozen stage, pain may lessen, but stiffness becomes more pronounced. You might find yourself unable to raise your arm more than a few degrees, and range of motion becomes severely limited. This can impact daily activities. Simple things like putting on a coat, washing your hair, or even driving can become challenging. During the thawing stage, movement begins to return slowly and pain continues to decrease. However, the recovery can be slow and frustrating, and some people never regain full range of motion. Diagnosis typically begins with a detailed medical history and physical examination. Your doctor will ask about your symptoms, any past injuries or surgeries, and your general health. During the physical exam, your doctor will assess both active and passive range of motion. That means they'll look at how far you can move your shoulder on your own, and then how far it can move when someone else assists you. One of the key features of frozen shoulder is that both active and passive range of motion are limited. This helps differentiate it from other shoulder problems like rotator cuff tears, where passive motion is often preserved. Imaging studies like X-rays, ultrasound, or MRI may be used to rule out other causes of shoulder pain, such as arthritis, calcific tendinitis, or a torn rotator cuff. However, they're not typically needed to confirm a diagnosis of frozen shoulder. Treatment for frozen shoulder focuses on controlling pain and restoring movement through a combination of medications, physical therapy, and in some cases medical procedures. In the early stages, pain control is crucial. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or naproxen, can help reduce inflammation and make movement more tolerable. In more severe cases, a corticosteroid injection into the shoulder joint may provide more immediate relief by reducing inflammation directly in the joint capsule. Physical therapy is the cornerstone of treatment and should begin as soon as it's tolerable. A skilled physical therapist will guide you through stretching and strengthening exercises tailored to your stage of frozen shoulder. Early on, these exercises focus on gentle range of motion movements to prevent further stiffness. As the condition progresses into the thawing stage, more active exercises are introduced to restore strength and flexibility. Home exercises are just as important as in-clinic therapy. Consistency is key. Patients who stick to a regular stretching routine tend to recover faster and more completely. Heat and ice can also be used as supportive therapies. Applying a warm compress before stretching can help loosen the joint, while ice packs afterwards can reduce inflammation and pain. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, most people with frozen shoulder improve with time and conservative treatment. However, if progress stalls or pain remains severe, more invasive options may be considered. One such option is a procedure called joint distension or hydrodilation. In this procedure, a doctor injects sterile fluid into the shoulder joint to expand the capsule. The pressure can help break up adhesions and improve range of motion. Another option is manipulation under anesthesia. Here, the patient is put to sleep and the doctor moves the shoulder through a full range of motion to break up scar tissue. While this can be effective, it carries a risk of complications including fractures and soft tissue injuries, and is generally reserved for more severe cases. In rare instances, arthroscopic surgery may be performed to release the tight joint capsule manually. This is typically only considered when other treatments have failed. The good news is that frozen shoulder usually improves over time, especially with a committed approach to treatment. Most people regain significant, if not full, range of motion, although it can take many months. The bad news is that recovery requires patience. It's not a condition that improves overnight, and setbacks can occur if therapy is interrupted. One important thing to note is that having frozen shoulder in one shoulder does increase your risk of developing it in the other, especially if you have underlying health conditions like diabetes. While not all cases of frozen shoulder are preventable, there are some things you can do to reduce your risk, especially if you're recovering from a shoulder injury or surgery. The key is to keep the shoulder moving. If your arm is immobilized for any reason, it's important to perform gentle range of motion exercises as soon as it's safe to do so. This can help maintain flexibility and prevent the joint from becoming stiff. For people with diabetes or thyroid disease, keeping your condition well managed may also lower your risk. Frozen shoulder can be an incredibly frustrating condition. The pain, the stiffness, and the long recovery time can take a physical and emotional toll. But the important thing to remember is that it's treatable. With the right approach, most people make a full or near full recovery and return to their normal activities. If you're dealing with frozen shoulder right now, know that you're not alone. Work closely with your healthcare team, stay consistent with your exercises, and be patient with the process. Progress may be slow, but it is possible. Thank you for watching. As always, take care of yourself and make the most of your day.